After days of lower than average PCR testing numbers and unreported rapid test results, today New South Wales had a hard correction, clocking 92,264 cases. That number includes more than 61,000 positive rapid tests dating back to January 1, though most were from the last 7 days. In Victoria, Premier Dan Andrews got the jump on National Cabinet with a big expansion of which workers are considered essential and therefore exempt from home isolation if they're asymptomatic.
Emergency services, education, critical utilities, custodial facilities, all transport and freight.
It applies to those vital workers within those sectors. So those workers that are undertaking critical roles, it is not an open carve-out for everybody who works in those sectors.
New capacity rules also mean Tennis Australia will only be able to welcome half as many punters at this year's Oz Open. And while the numbers are still rising in Queensland, border checkpoints and pre-travel rapid test requirements will be dropped this Saturday. Straight out of NatCab, the PM also had ISO on his mind.
To further ease the pressure on supply chains, we extended the easing of restrictions for close contacts. So that's the one which enables someone who may be a close contact, they get a negative RAT test and go straight back to work.
And for parents anxious about school returning, a commitment to keeping schools safely open at the core of the economic plan.
So it is absolutely essential for schools to go back safely. Schools open means shops open. Schools open means hospitals are open. It means aged care facilities are open. It means essential services and groceries are on the shelves.
So as we continue to redraw COVID boundaries, will these new changes get Australia back on track or see cases spiral further out of control?
Well, clinical epidemiologist Professor Nancy Baxter is the head of Melbourne University School of Population and Global Health. Nancy, good to see you. You often talk about the need to balance safety with keeping society functioning. Do you think all of this achieves that?
Well, we're at the point of compromise now, so none of these are good options that we have, but we have to move forward. They're also not based on science, so there hasn't been any major change in how long people incubate Omicron for. But basically, anyone who's gone to the grocery store, I was just at the grocery store now, and I didn't have any problem finding burgers because I eat veggie burgers, but the meat aisle was pretty bare. So we obviously need to get food on shelves. We need to keep our power on. We need to keep our internet on. But it will potentially fuel transmission.
Nancy, the PM said that for Australia to be open, schools need to be open. Do you think parents can be confident in sending their kids back to school?
Well, people often say that schools should be last to close and first to open, and that's for a number of reasons. One is because kids need to be in school, and also, parents need kids in school to actually be able to function. So I think it's important to get schools open, but unfortunately, it is going to be happening kind of just as our wave in Victoria and New South Wales are kind of slowing down, and it's also going to happen before kids are fully vaccinated and potentially before a lot of teachers are boosted. So I think there is risk of going back to school. I think it's manageable risk. Like right now, it's all about how we manage risk. I think there definitely should be choice in terms of parents being able to choose not to go back to school if they're concerned particularly about their child.
Nancy, I totally understand the need to put food on shelves to keep the power on, to get those essential services running. Is there a risk, though, that this decision will backfire and fuel the spread of the virus, and then that makes life harder for our health workers?
Well, absolutely. I mean, think about it. They changed the definition of close contact. So, if you've been beside someone working with them and they have COVID, you're not considered a close contact in that circumstance. Somebody is a close contact, they're actually a household contact, meaning they're potentially exposed all the time to that person who has COVID. They're going into work, they're doing rapid antigen tests, they're wearing masks, but all of these things, require that they're actually done and done well if you want to protect the other people at work. So there's a real chance that you're going to increase the spread and spread in essential services because that's where this is being delivered. So it's really important that care is taken in how this is done. And I'm not entirely sure that is in place.
With the high transmissibility of Omicron, is a 50% reduction in attendance at a massive sporting event like the Australian Open enough to stop the spread?
Well, again, it's about risk. I guess if you really wanted to reduce the risk of any spread at the event, you'd have it done without audience. So again, it's this compromise. It's trying to find a balance. Obviously, having a crowded stadium and crowds coming in through the pinch points at the when you're entering, that's pretty unsafe right now, given how many people have Omicron. I think reducing that will reduce the crowds and also space out the audience. So would I prefer there to be no audience? In terms of reducing the risk of transmission, yes. But I think that this is a compromise that probably will work.
Nancy, back in the days when Australia didn't really have COVID circulating in the community, remember a lot of the leading voices saying, look, coming out of this, it's going to get really bumpy. Do you think it gets bumpier from here, or is this the worst of it?
Well, I'm kind of hoping that I kind of fade into oblivion for your viewers, so I hope it doesn't get bumpier. But there will be bumps, for sure. There will be bumps, and the problem is that it's really hard to predict. We don't know what the next variant's going to be like. We know there will be one, but we don't know whether it's going to be potentially worse, like more serious and more transmissible. I mean, that's what happened with Delta, and that could happen again. Fingers crossed it doesn't. And we'll have a lot more immunity by then, including the immunity that we're all getting from Omicron. So hopefully we'll be able to face it better. But I must say, with this wave, what we seem to have done is we seem to have hoped for the best and planned for the best. And I think what we need to do in the future is hope for the best and plan for something that's worse than the best. We really need to do that so that things don't seem such a shambles to people and there isn't so much disruption.
Even if you fade into oblivion, you will always be in our hearts. Nancy Baxter, thank you very much.
Have a good night.